Good afternoon. Welcome to the WIC webinar. The Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, is one of the largest nutrition programs in the U.S., providing not only access to specific foods, but also nutrition education and health and social service referrals for low-income infants, children up to age 5, and women who are pregnant, breastfeeding, or postpartum. The program's goals have evolved to include promoting and supporting breastfeeding by providing the breastfeeding mother with benefits up to 1 year, providing WIC participants with a wider variety of foods, including vegetables, fruits, and whole grains, and providing WIC state agencies greater flexibility in prescribing food packages to accommodate the food preferences of WIC participants. So once again, welcome to the webinar on review of WIC food packages, improving balance and choice. Our speakers for today are Dr. Kathleen Rasmussen, the Nancy Schlegel-Meinig Professor of Maternal and Child Nutrition in the Division of Nutritional Sciences at Cornell University, and Dr. Shannon Whaley, Director of Research and Evaluation for Public Health Foundation Enterprises WIC program, the largest local agency WIC program in the nation. Just a few quick things before we get started. The audio for today's event will be streamed through your computer speakers. We will be taking questions through the Q&A box located in the lower right-hand side of your screen. Simply type your question into the box at any time and click Send. We ask that you leave the box set to send your questions to all panelists. This webinar is being recorded. Please understand that any questions you submit may be read aloud and included in our recording. If you have any technical issues during the event, please contact the WebEx technical support at 1-866-229-3239. Once again, the number for WebEx technical support is 1-866-229-3239. With that, I'd like to turn things over to our first speaker, Dr. Kathleen Rasmussen.
Good afternoon, everyone. I'm pleased to speak with you today about the work of the committee to review the WIC food packages, of which I served as chair and Dr. Whaley as co-chair. Today we have a nice range of tasks for you. We're going to tell you about what we were asked to do by USDA, the framework and criteria we used to make our decisions, how we thought about cost neutrality, that was part of our assignment, how we made decisions, and then discuss in considerable detail the food package changes and end with some recommendations about breastfeeding. So we were given a long and complex task that is summarized here. The task was to recommend revisions for the WIC food packages that are culturally suitable, cost neutral, efficient for nationwide distribution, and not burdensome to administer. What this meant in practical terms is that we were to review the scientific literature to assess the current WIC food packages for consistency with the Dietary Guidelines for Americans, otherwise called the DGAs in this presentation, to review the nutritional requirements of the WIC population, and conduct analyses of their intakes of nutrients and foods, conduct food expenditure analyses, and also conduct sensitivity analyses and prepare a regulatory impact analysis. We will not be talking about those activities today. In conducting our work, we needed some criteria to tell if we had succeeded in meeting our task. And to this end, we had a number of criteria that we used. This first one is new since the 2006 proposed revisions to the food package that were implemented in 2009. And it's also new since our interim report, as we decided we needed additional criteria in order to be able to make good decisions. And this first criterion is that the packages should provide a balanced supplement to the diets of women and children. And what we meant by a balanced supplement is provided in the bullets. that the WIC food packages should provide a moderate proportion of an individual's requirement for a particular nutrient or recommended amount of a food group. The supplementation target might differ depending upon the nutrient or food group and the degree to which foods available in the marketplace can supply these amounts. And accommodation for cultural suitability and food preferences is acceptable and in some cases was required. The remaining criteria are criteria that have been used previously. And first, these are that the packages should contribute to the reduction in the prevalence of inadequate and excessive nutrient intakes and an overall pattern that is consistent with relevant dietary guidance. Moreover, the foods in the packages should be available in forms and amounts suitable for low-income persons. They should be readily acceptable, commonly consumed, widely available, account for cultural eating patterns and food preferences, and provide incentives for families to participate in the WIC program. And finally, they should not create an undue burden on state agencies or vendors. To do our work and to organize the information, we decided that we needed a decision tree. The decision tree that we created is too complex for a good slide, but what it did was make our process completely transparent. So if you want the details, they're in the book, but we've summarized them here so that you can see what we did. The inputs to the decision tree were analyses of NHANES data that gave us information on nutrients that were inadequately consumed by WIC participants, amounts of food groups that were consumed below amounts that were recommended. We calculated the amount of nutrients and foods in the package compared to recommendations. We calculated the gap between what's recommended and what people were actually consuming. We assessed the acceptability of foods, the availability of foods, and the public comments that we received. That information was put in our decision tree, which is a stepwise process for deciding what to do with it. And it produced a number of outputs. The first of these is priority for action. Which of these were more important? And they were more important because of the degree of inadequacy or the degree to which food group consumption was poor. It helped us to identify potential changes in food amounts by increasing them or decreasing them relative to where they were at present. Potential substitution options, potential new foods or new forms, potential increases in the cash value voucher, which is the amount of money that is on the voucher that can be used to procure fresh vegetables and fruit, or the old standby no action because the current situation is really quite adequate. We also, once we had this information from the decision tree, that gave us information about removing foods or adding foods as I indicated, and also changing the kinds of foods that might be in the packages. And with that, we developed the new packages. We did the estimations that I described. We conducted sensitivity analyses, and then we estimated costs. This is an iterative process. And the estimating costs caused us to go around this circle a few times, also the results of the sensitivity analysis, until we had a stable package in terms of its content and a price that was within the framework that we were given by USDA to work with. And the requirement from USDA was that the package should be cost neutral. And what USDA meant by that was that the weighted average per participant cost of the revised and current food packages must be within 10 cents of one another. And this is calculated by determining the cost of each food, then each package, and then linking this to the participants per package nationwide. Now, what this means effectively that if you want to add something to the package, something has to come out. And it also means that you can do less when there are lots of participants in a given category than you can do when there were fewer participants. So, on average, Children comprise 53% of the participants, and so small changes there have large effects. If you add $1, for example, to the cash value voucher, it's going to make a 40-cent change in the cost, which would be way above our cost limits. For fully breastfeeding women, those are only 3% of WIC participants, so big changes have small effects. Similarly, if you added $1 to the cash value voucher, it would make a 3-cent change. So these are really quite different outcomes. Now, with that, I'd like to switch over to Dr. Whaley, who's going to talk in detail about the packages.
Thank you, Kathy. Let's see about my technology. Voila, it worked. Welcome, everyone. So let's dive into what the committee ended up recommending for the revised food packages. And it's important to remember that these are recommendations. If I occasionally slip up into calling them what's happening, that is my mistake. We have the current food packages right now that are in play, and what we're talking about in the following slides are the recommendations from this committee. And Kathy really nicely walked us through the concepts of balance and supplemental. So the amount of foods in the recommended packages reflect these two concepts. So Kathy also ended talking to us about how every time you add something, you must take away. So you'll see here that the overview of the changes to the food packages will show increases in the cash value voucher. Remember, that's the WIC instrument families can use to purchase vegetables and fruits, increases in whole grains and increases in seafood. And in order to accomplish those increases, you'll see decreases in juice, milk, legumes, peanut butter, infant cereal, infant vegetables and fruits, and infant meats. So I'm going to walk you through a series of slides about each of these groups, starting with the CVV. So again, this is a cash value voucher for the purchase of vegetables and fruits. Across the board, the committee recommends increases in the cash value voucher. As a committee, we had access to some redemption data from states that are currently using EBT systems, and those states showed fairly high redemption of the CVV. The CVV also offers the most flexibility for participants to purchase what they want to purchase and to align their purchases with their cultural eating habits and other food preferences. The CVV provides a wide range of nutrients, including the priority nutrients, potassium and fiber as examples, but I suspect many nutritionists are on this call and can talk all about the virtues of vegetables and fruits. And also by increasing the cash value voucher, there's hope by the committee to particularly increase vegetable purchasing. Vegetable intake is particularly low for most WIC participants. So the hope is that the increase of the CVV enables families to meet their fruit needs and move on and purchase vegetables. So you're going to see a series of slides that look just like this with 3 columns of data. The first column is always what we're currently doing at WIC. So WIC currently is issuing an $8 CVV to children and an $11 CVV to women. The second column is always going to show you the recommendation for revision. So here you see the committee is recommending a $12 CVV for children, a $15 CVV for the pregnant woman, a $25 CVV for the partially breastfeeding woman, a $15 CVV for the postpartum non-breastfeeding woman, and a $35 CVV for the fully breastfeeding woman. The final column then shows you the difference. So on each slide, I'm not going to walk you through just the way I just did. Hopefully you now have a sense of how these slides are formed, so you can take a look as each slide comes up to look at the current, the revised, and the difference. I will be touching later on the increases to the partial and fully breastfeeding women and why those CVV increases are higher. There also are some additional opportunities to increase the CVV. One of the things the committee was quite interested in is offering options for participants so they have choice whenever possible. So another way participants could choose to increase their cash value voucher would be to exchange 64 ounces of juice for a $3 addition or enhancement to their CVV. What this means is a participant who would like juice can still get juice. So they may opt to keep their 64 ounces of juice. And for the participant who would really prefer not to have juice and would rather have a higher CVV, they can opt to enhance the CVV with an additional $3. Another recommendation the committee makes has to do with the jarred infant fruits and vegetables. Right now, under current policy, infants who are 9 to 11 months old, there's an option for them to substitute some of their jarred fruits and vegetables for a $4 CVV. That's currently limited to infants 9 to 11 months old. The committee recommends that all infants from 6 to 12 months or 6 to 11 months, when they're issued this benefit for fruits and vegetables, that all participants be given the choice, 3 choices. If jarred vegetables and fruits meet their family's needs, they can continue to receive the 128 ounces of jarred fruits and vegetables. For those families who don't want any jarred fruits and vegetables, they could substitute all of their jarred fruits and vegetables for a $20 CVV. And for those families who want both for their infant, they could take half of the jarred fruits and vegetables and take the other $10 in a CVV. So again, the intention here behind the committee was to offer as many choices as possible to meet the needs of the many families served by the program. What this means then, again, here's another one of these slides with your 3 columns, is with the additional opportunities to increase the CVV, we see increases over the current amounts by $7 to $27. So juice. Juice is also recommended to be reduced. The rationale behind this is that whole fruit is currently the universally preferred form, both according to the American Academy of Pediatrics and the DGAs that Kathy mentioned at the beginning of this webinar. Right now, the current food packages for children provide over 100% of the American Academy of Pediatrics recommendation for juice. And Kathy talked to us at the beginning about one of the guiding principles of this committee around the concept of supplemental. And the committee's view was that 100% or more did not meet, was not consistent with the view of the WIC program being a supplemental program. So revisions for juice reduce the amounts such that juice is then a more supplemental amount. This reduction in juice also, given the cost-neutral requirement, freed up some funds to support that increased value of the cash value voucher. So this slide shows you the current amount of juice, the revised recommendations, and the difference. All right, let's talk about fish. Seafood intakes are below recommended amounts in almost all WIC participants. Fish is currently only issued to the fully breastfeeding woman on the program. It's not in any of the other food packages. Inclusion of fish would improve the balance across food groups and significantly improve consistency with the dietary guidelines and introduces seafood into the diets of WIC participants. So because of our cost-neutral requirement, what the committee recommends is including fish as part of a rotation with legumes and peanut butter. And I'll talk about that more in a moment. But first, let me show you the recommended amounts of fish to be included in all packages. You see a whole lot of zeros in this first column. Currently, 0 fish is being issued to most WIC participants, with the exception of those fully breastfeeding moms down at the bottom of this chart. You see with the revisions, the recommendations would allow fish in all the food packages, of course with the exception of the infant package prior to 6 months, because there is no food in that infant package prior to 6 months, but all the additional packages would allow fish to be added. For the infant 6 to 11 months who's fully breastfeeding, that can happen through a substitution of some of the jarred meats. So let's talk about the complexity of this rotation. There have been some questions on this since the release of the report. It's really twofold. One of the issues was the issue I mentioned already, and that's the issue of cost. As you saw before, when we add a food, and it's a food that's added to a lot of people, food package cost goes up very quickly. So you have to reduce things in order to bring the cost into neutrality. The second very significant issue is this concept of supplemental. And when the committee looked carefully at the amount of beans and peanut butter currently issued, particularly to children, although this is also an issue for women, the amounts of beans and peanut butter currently issued are far above supplemental. The current package for children provides 177% of the recommended amount of legumes and 167% of the recommended amount of peanut butter. So the committee grappled with thinking about how to provide beans and peanut butter in a supplemental amount. Of course, the first thing one thinks about is changing package sizing. So peanut butter currently is offered in a 16 to 18 ounce package size, and beans is offered in a 1 pound bag. And for those of you who've gone to the grocery store, which I suspect is most of you, it's very hard to find an 8 ounce jar of peanut butter or a ½ pound bag of beans. So the easy solutions of changing package sizes or having reasonable package sizes very quickly fell off the table. So in order to bring beans and peanut butter into alignment as supplemental foods and bring in fish, something that is not currently available, the committee recommends a rotation of these foods. All 3 foods are shelf-stable, enabling families to be able to keep these foods for a certain number of months. They are not going to go bad until opened. So this slide shows you then about peanut butter being reduced in all packages, showing you the current amount, the revised amount, and the difference. And apologies that I neglected to include a similar slide on legumes, but it is quite similar to this. So, whole grains. We know intakes of whole grains are below recommended amounts in 100% of WIC participants. This is an area for us to work on. A range of package sizes also would permit commonly available sizes of all options to be acquired. Currently, in the current food packages, the package size allowed is 16 ounces. So the committee recommends expanding whole grain options. These additional whole grains for authorization would include cornmeal, corn masa flour, buckwheat, and teff. This does not mean that states are required to do this. What the committee is recommending is that the regulations allow states to choose these whole grains should they have participants who would like to purchase them. This is exactly the same as what is currently happening. The current federal regulations require states to authorize 100% whole wheat bread and 1 additional whole grain. And so this is just essentially adding to the list of whole grain options that states may choose from, again, with the goal of getting more options to participants where participants would like them. These options are all commonly available in a 24-ounce size. And also, at the same time, while we're thinking of whole grain, the committee recommends that all breakfast cereals meet the whole grain-rich criteria. What that means then is the committee is recommending a range of package sizes being offered for whole grains from 16 to 24 ounces. This enables participants to purchase the much more widely available 22 to 24 ounce size of whole wheat bread. It also enables, at 24 ounces, to potentially purchase 2 of the smaller whole grain pasta options. Again, the full intention here is to get options for participants to purchase foods that meet their whole grain needs. You do see here that for women, this means there's an increase in whole grains in their packages, and for children, it means there's a small decrease because children are currently authorized to have 2 16-ounce containers. And this partially drove the committee's recommendation that all breakfast cereals be whole grain to compensate for this difference here. All right, dairy. The amounts of dairy in the current package also are greater than supplemental. The committee's recommendations allow for additional, more expensive yogurt substitutions to help promote intake, and these substitution options would eliminate the need for the dangling quart. So for those of you in the WIC audience out there, you know exactly what I'm talking about. And for those of you less familiar with the dangling quart, this is an artifact of current substitution options that leaves 1 quart of benefits remaining so that vendors end up having to carry and stock a quart. So our intention was to eliminate that challenge. The committee also recommends allowing a range in package sizing for yogurt from 30 to 32 ounces. This, again, would be intended to be a state option, but the 30-ounce would enable states to authorize 6 packs of 5-ounce yogurts. So it's, again, intended to give states more options for yogurt. This slide shows you what is currently offered for milk, what is the revised amounts, and the difference. All right, so let's shift gears a bit to infants. Breastfeeding is a very significant part of WIC's goal for improving infant nutritional status. WIC provides breastfeeding education, anticipatory guidance, and support for breastfeeding. And the USDA policy guidance on breastfeeding that came out just last year, sort of right in the midst of committee deliberations, really clarified that WIC regulations require breastfeeding promotion and support be made available to all participants as appropriate, with a minimum of 2 education contacts within a 6-month certification period. So there's very clear guidance and clear support for breastfeeding within the WIC program. What the committee learned in their both exploration of research and in their travels, one thing the committee was required to do was every committee member had to travel to a WIC program, either in-state or out-of-state, and not only observe all WIC activities in the site, but go shopping with the WIC benefit. So I think that was a really important part of the committee's work. In that work, it becomes clear pretty quickly that breastfeeding support is not uniformly available. Certainly there's breastfeeding support available everywhere, but how it looks and how it's conducted and who receives it is subtly different from place to place, and not every mom that walks into WIC has the same access to the kind of breastfeeding support that other moms have. And the committee felt pretty strongly that partial breastfeeding, that's what PBF stands for, may be more achievable for women than exclusive breastfeeding. So our vision as a committee is actually quite similar to the previous committee's version, and I think quite consistent with the USDA breastfeeding regulations, and that is that all women receive adequate counseling and support for breastfeeding prenatally and through the first month postpartum. The committee continues to agree with the current policy that infant formula is not issued routinely in the first 30 days to breastfeeding women, and that women who request infant formula, for those women, its issuance be individually tailored to the needs of the dyad. The committee feels that breastfeeding of any intensity must be supported, and the real point of divergence between what the current policies allow and what the committee has recommended has to do with the period of the first 30 days postpartum. The committee looked quite a bit at the study, it's called the Birth Month Study, done by Park Wilde and colleagues at APT. Their study was released in late 2011. The data collection happened in the year prior to the food package change, as well in 2009, as well as the year post the food package change, in 17 randomly selected local WIC agencies from 4 USDA census regions, so moms from really all around the country. And what their study found is following the 2009 food package change, there was decreased issuance of the partial breastfeeding package, and that actually was an intended effect, but also increased issuance of the formula feeding package. And in looking at these data, the committee saw that most likely this seemed to be because women who were not confident about breastfeeding or needed some formula to be able to breastfeed at all moved to the formula feeding package. So for those of you really interested in this study, I recommend reading the full report. There's both the report from 2011 and a publication in 2012. I have created this slide, frankly, to help myself, and hopefully it's helpful to you as well. I think what the 2009 food package changes intended was to increase exclusive breastfeeding. And in this way, it was partially successful. Exclusive breastfeeding did increase in months 0 through 3, but at months 4 and 5, we actually see lower rates of exclusive breastfeeding post-food package change than we had pre-food package change. The partial breastfeeding changes happened as intended. We intended to see less partial breastfeeding after the changes, and in fact saw less partial breastfeeding after the changes. And really, I think the big divergence was in formula feeding. The intentions of the 2009 changes were to reduce formula feeding, effectively moving people away from partial breastfeeding into exclusive breastfeeding. Unfortunately, it seems the outcomes were increases in formula feeding after 2009. And when you look at the report from months 0 to 5, we see increases in issuance of the full formula package by sort of 18 to 39%, depending on what month. So this really was one of the big unintended consequences of the 2009 package change that caused the committee to look very closely at those first 30 days. If you do go back to look at the birth month study, they wrote two very important policy implications. One implication was recommending further increase in the economic value of the full and partial breastfeeding packages relative to the full formula package. And the other was increasing staff training and strengthening breastfeeding promotion efforts at WIC. And the committee also felt that is very important. So in terms of food package 1 for breastfed infants in the first 30 days, the committee recommends maintaining no formula for exclusively breastfeeding dyads, but for partially breastfeeding dyads, pending a careful assessment of the needs of the dyad, increasing the allowance in the first 30 days for formula from the 104 ounces currently allowed in some states, that's a caveat there, up to the amount currently allowed for the 1 to 3 month old, which is 364 ounces. Some states currently allow no issuance of formula in the first 30 days, and some states have taken the policy to allow 1 can or 104 ounces in the first 30 days. So the recommendation of this committee is to broaden that a bit further to allow for a bit more partial breastfeeding in that first month in the hopes that it keeps mothers breastfeeding and not pushing them into a full formula package. The committee recognizes very much that breastfeeding changes don't happen from a food package alone, and the resources are needed to provide breastfeeding support from well-trained staff across the country. So let me finish my part by just walking you through the dyadic packages. We call them the dyadic packages between mom and baby. So the first column here is your fully breastfeeding dyad with infant food package on the top and mom on the bottom. The middle column is your partially or mostly breastfeeding dyad with infant on the top and mom on the bottom. And the third column is your formula feeding dyad. So starting with formula amounts, this committee, again, is recommending that the up to 364 ounces start at birth, start in month 0. And that's effectively the only change the committee is recommending from what is currently approved. Over on the right, with the full formula feeders, the amounts you see here are identical to the amounts available in the current food packages. I will say this is a point of divergence from the committee's concept of supplemental, because this amount of formula for the fully formula-fed infant from 0 to 5 months really represents 100% of their nutrient needs during that period. And of course, we talked to you many times that the goal of the committee was to think about WIC as a supplemental program. The committee was concerned, however, that reducing the amount of formula would impose a financial burden on families or potentially lead to over-dilution of formula with no suitable, affordable alternatives. So at this time, the committee has recommended keeping current formula amounts as they exist right now in the WIC food packages for the fully formula-fed infant. Moving down, you see some reduction in infant meats. The current packages allow 77.5 ounces. The committee noted that the redemption of this item is the lowest of all foods in the WIC food packages and looked for other options unsuccessfully. There's quite a bit written about this in the full report. So infant meats are recommended still just for the fully breastfeeding dyad at 40 ounces, and a substitution can be made of some of that meat for fish. Infant cereal, 16 ounces of infant cereal provides 100% of the iron needs for infants. So it is maintained at, it's currently then recommended for 16 ounces to be issued to the fully breastfeeding infant who is not receiving formula where they're going to get iron through formula. And then 8 ounces be issued to the partially breastfeeding and fully formula feeding dyad. And infant jarred fruits and vegetables now are recommended to be equivalent across the 3 groups. Currently, infants, the fully breastfed infant is issued 256 ounces of jarred vegetables and fruits from 6 to 11 months. What the committee opted to do is reduce the amount to the infant in order to exchange these dollars to the mother. So here we see the committee recommending a $35 CVV for the fully breastfeeding woman, a $25 CVV for the partially breastfeeding woman, and a $15 CVV for the non-breastfeeding woman. I want to be clear, this is in no way intended to be interpreted as anything punitive to women who don't breastfeed, but absolutely about the significantly higher caloric and nutrient needs of the breastfeeding woman, where the fully breastfeeding woman has the highest needs and the partially breastfeeding woman follows her. This also was intended to bring the fruit and vegetable incentive, which was quite distal at 6 to 11 months for the infant, much more proximal to right after the delivery of the baby, with added benefits to the mother herself. Finally, eggs are exactly the same, no recommended changes here, and you see now fish incorporated into all three packages at varying levels. So Kathy, that ends my section, and I'd like to pass it back to you. Kathy, I'm not hearing you. Are you there?
Oh, my goodness. I'm the one with the mute on. Thank you. The committee made a number of recommendations for implementation and research. We had many tasks, and that led us to these numerous recommendations, but we're going to concentrate today on just the implementations related to breastfeeding. So let's begin with one on implementation. The committee recommends that the Food and Nutrition Service at USDA should maximize the extent to which the revised food packages motivate the choice to initiate and continue breastfeeding among all racial and ethnic groups by enhancing and stabilizing the funding that's available independent of the food packages for peer counseling and other lactation support in WIC sites, as this is a separate stream of funding. The major recommendation for research related to breastfeeding is that the Food and Nutrition Service at USDA should fund data collection and analysis of that data toward optimizing support for breastfeeding and increasing the proportion of WIC participants who choose to initiate and continue breastfeeding, and tailoring food package options to best meet the needs and goals of the breastfeeding dyad. Now, to help us see the overall effect of the many changes that Shannon described for you in detail, we constructed this graphic. It's a regular old graph. The x-axis has two groups, the current food packages on the left and the revised food packages on the right. These are based on actual data, and the data are for children because our dietary data for children were of much higher quality than our data for women because we had data from many more children than women. And we are expressing these as we expect the packages to be redeemed by the children, because children can only consume what's actually redeemed. They can't consume the voucher. What's on the voucher. They need the parent to actually acquire the food. So what's expressed on the y-axis is the proportion of the amount that's recommended for that food as actually redeemed. And you can see at present there are some foods that are highly redeemed and some foods that are basically at the bottom, such as seafood and vegetables. What the revised package does is bring these toward the middle, trying to raise the ones that are at the bottom, such as seafood, where we expect to be successful, the eggs, where we think things will go up, whole grains, we think it's going to go up a lot, and also reducing the items that are in excessive amounts, the legumes, the nuts, seeds, and soy, the fruit juice, and so on. So this leads us, this kind of data leads us to our conclusion that we feel that the revised food packages improve the balance of the package relative to the dietary guidelines, which was one of our chief tasks. You've heard many ways from Sharon that the packages increase flexibility and choice for participants to meet their cultural needs and other food preferences. And they provide better support for the mother-infant dyad as a group. They provide more distinction and more value to the breastfeeding dyads. However, the committee also feels it's important to provide adequate and consistent support of breastfeeding if WIC is to achieve its breastfeeding goals, and that collection and accessibility of WIC program data are critical for future program improvement. This committee's work was a mandate of Congress, and it's mandated to happen again in 10 years, and the committee really felt it was important for WIC to make the best use of the data they have, or to create the data that would be necessary for a future committee. This is the committee in person at its last meeting that was held in Woods Hole, Massachusetts, at the facility the National Academies has there. The lady in the blue shirt on the left is the chair of the 2006 committee, Suzanne Murphy, who served as an unpaid consultant to the committee, and we much appreciate her services. We also have other consultants in the group here and, of course, our very fine staff. The members of the committee are named here. In addition to me and to Shannon, Susan Baker from the University of Buffalo, Marion Bittler from UC Davis, Patsy Brannon from Cornell, Alicia Karakiri from Iowa State, David Davis from South Dakota State, Mary Kay Fox from Mathematical Policy Research, Tamara Hatfield from UC Irvine, Helen Jensen from Iowa State, Rachel Johnson from the University of Vermont, Angela Odoms-Young for the University of Illinois at Chicago, Rafael Perez Escamilla from Yale University, Catherine Ross from Penn State, and Charlene Russell Tucker from the Connecticut Department of Education. We are most indebted to our study director, Marie Latulippe, and Megan Quirk, a program officer who is particularly responsible for our regulatory impact analyses, our research associates, and also to Dr. Yaktine, who's the director of the Food and Nutrition Board. And with that, I will say thank you very much for listening to this webinar. We have a location here where you can download the report and the materials. And I don't think we're going to be contacting Marie Latulippe at nas.edu, so when I hand this back, someone is going to tell us what is the address for email if someone would like to do this, because Dr. Latulippe has, Ms. Latulippe has taken another job. So with this, I believe we are open for questions, so please send your Q&A to that box on the right, and we look forward to hearing from you.
Okay, thank you very much, Dr. Rasmussen and Dr. Whaley. We're going to turn to questions now. The first question, can you elaborate on the decision behind the proposed whole grain requirement for breakfast cereals?
Yes, we can do that. I'll take a part, and I think Shannon will also take a part. We observed that this requirement is the same as in the 2006 committee, but it's stated less ambiguously. And we find that when participants are offered the option between the food that meets the whole grain requirement and the one that doesn't, the whole grain cereal is not being chosen, and participants do need to meet this requirement to meet the dietary guidelines, so the committee is saying please meet those requirements. Shannon, did you want to say something else about it?
I think the main thing is that this is effectively following through on what Kathy said about the 2006 committee. This was their recommendation. And carefully looking at it, it seems that that's not how it was implemented, and the committee went back to just reinforce the original recommendation of the 2006 committee. This committee also looked very carefully at the marketplace. Since 2006, there have been very significant changes to cereals in the marketplace. So I think this is also better timed to have this change where whole grain-rich cereals are required, because frankly there's many, many more options available now than there were in 2006.
Okay, thank you. Next question, if the mother is vegetarian or vegan, what happens with the packages?
Oh, we have a whole chapter on that, and I didn't read it before this webinar. Did you, Kathy?
Oh, but the idea here is that she has a number of possible substitutions. We were not able to provide her a substitution for each possible component of the package, but there are available substitutions for vegetarian and vegan women.
Okay, thank you. Here's another question. Will WIC participants have to make choices for food options at the time they pick up their vouchers, or while they make their will they make their decisions while shopping?
The committee did not include that in our recommendations. We felt very strongly that the states have much more expertise in that, and that fell outside of our task in terms of when choices had to be made. So the report is silent on that question.
Okay. We have a couple of questions on breastfeeding and the use of formula. Do you think that there will be any unintended consequences to increasing the formula in the partially breastfeeding mother food package?
Well, this is one of the things that the committee had to grapple with very carefully. If your objective is to maximize the number of women who exclusively breastfeed, providing any formula at all is not a great idea. If your objective is to increase the total number of women who offer their milk to their babies, then formula is necessary in the WIC context. The committee reviewed the literature on barriers to breastfeeding in low-income women in general and WIC participants in particular, and it became very obvious that partial breastfeeding was more possible for many of these women than exclusive breastfeeding. And if the objective is really to be sure that the baby gets as much of mom's milk as possible, then some formula is likely required for those women who are returning to work and working in, or beginning to work and working in environments in which breastfeeding is very difficult. So we do recognize the downside, but we also felt there was an upside to making breastfeeding possible. Also, many women in WIC will have another child, and if they've had a successful breastfeeding experience, they may actually come back and have another one, and it might be at that point that they're at home and able to exclusively breastfeed. We're optimistic about this, but unintended consequences are always possible.
Okay, thank you. We have a rotation substitution question. Would more legumes be acceptable if meat wasn't being consumed?
That sounds similar to the vegetarian question, and forgive me for not remembering the specifics around that, but I do believe the committee in that chapter we do talk about a substitution for fish with beans for those moms. And did I get it? I'm not sure I got the whole question.
Yeah, I think so. Mm-hmm.
Okay.
Okay. What consideration were given to the cultural needs and food preferences for fully breastfeeding women who follow the vegetarian diet? So kind of another question on that theme.
Darn, I should have studied that more. But we didn't do anything differently for full breastfeeding women than for other women who are vegetarians. Their breastfeeding status didn't influence the substitutions that would be possible because the packages are not that different in quality. They're just different in quantity for the most part. Is that a fair statement, Shannon?
Mm-hmm.
Okay. So then, just for clarification, how would the rotation between fish, peanut butter, and legumes be kept track of?
Again, we learned in our explorations of these various site visits that the experts on this are in states, state WIC directors, the state staff. So the committee did not include as part of the report, didn't feel it was part of our task to comment on the details of how it gets implemented. Many of us observed the current rotation with beans and peanut butter. We really look to the expertise at the state level in terms of integration of the rotation into MIS systems. I do think it's important that these are shelf-stable items. So whatever options can be thought of in terms of issuing, all at one time or meeting them out over various months, I think really need to be discussed at the state level.
Okay. So next question is, could you please speak more about some of the challenges facing the WIC program to provide breastfeeding support?
Shannon.
I can. Anne, I need your recommendation here. As a member of the committee, there were the challenges that Kathy discussed in her previous response, having to do with barriers to breastfeeding, et cetera. This question sounds a little broader, a little more current, sort of things that have happened since the January release of this report. But what I think I want to hammer home is the diversity of what's available from state to state is, I think, problematic. I think we need to see consistent, available breastfeeding support for all women, even women who, during pregnancy, think they can't breastfeed, don't think they want to breastfeed. I think the support needs to happen prenatally and be available to all women. I think that's wildly consistent with the current USDA goals, so I don't think what I'm sharing here is divergent from what the goals of the program are right now. But what the committee struggled with is the recognition that a food package alone isn't going to solve breastfeeding. What is going to help solve breastfeeding is additional support through staff that can be provided to these moms. Kathy, any other comments on that?
Basically no. I'm not sure we fully addressed the question. Anne, would you read the question again, please?
Yes. So the question was if you could speak to the challenges that the WIC program, and I presume that means the administrators of the program, would face in terms of encouraging or promoting breastfeeding.
We see that the biggest challenge is not the encouragement or promotion, it's actually delivering the support that's necessary to help women make a decision in favor of breastfeeding, to help women implement that decision, to help women solve breastfeeding problems once they're giving breastfeeding a try. So we feel WIC is moved a long way in providing the promotion of breastfeeding, but support is the area where extra effort is required.
And the reality is that support comes from funding. I mean, it requires dollars to support that, and that comes both from Nutrition Services Administration funding and from the separate set-aside funding for peer counseling. The peer counseling has never been funded at the $90 million recommended. I might go off the rails here, Anne, so stop me, but the current House and Senate bills are looking at the allocations for peer counseling. One has it at $80 million, one has it at $60 million. Currently, right now, it's at $60 million, so $80 million would be a vast improvement. I think getting to $90 million is an even better goal. But right now, sure, peer counseling is available in most states, but it's not available to most women. We can't get to huge breastfeeding success until we can find the funding to support the staff that are needed to provide them, to provide that support.
Okay. So switching gears a little bit, the next question asks, current nutrition research shows fat from dairy, for example, whole and 2%, does not contribute to overweight and obesity in children and adults. Given the concerns about retention in the program, was there any discussion about allowing participants more choice for milk?
The fast answer to that is yes, we did talk about it. Those of you on the call should realize that the committee operates by a specific set of rules, and we were required to look at published evidence, and our looking at the evidence ceased at the moment we submitted this report for the required anonymous peer review, which occurred about last November, October, November last year. This is an area of current research. The committee did not feel that we were in a position to declare the evidence available to us as settled and thus suitable for making a different decision than the decision about which kinds of milk are used and for which groups at present. That may well change in the future. There is tantalizing evidence happening as we speak, but until that evidence reaches a more settled state, no committee would be able to make a much different decision on this matter. This will be reviewed again, maybe before 10 years are up, but at this point, what we can say is that we use the evidence that we had at hand and did not view it as sufficient at the time we had to decide to make a decision other than the decision that we made.
Okay, thank you. Another related dairy question, actually two of them. We'll look at the first one and then the second. First one, can you discuss considerations related to adding more yogurt, especially in the context of lower milk redemption? And then can you talk more about the second court option for breastfeeding women? Must she choose between cheese and yogurt?
I did not read up on our substitution options, but it is intended to be able to get 2 quarts of yogurt instead of 1. And I don't want to say the wrong thing. Our intention was to eliminate this problem of choosing between one or another for the breastfeeding woman, but I'm going to have to go back to the report myself to look at our specific recommendation.
Okay, so it is in the report, and we may be able to find that questioner.
We have a table very explicitly delineating the substitution options.
Okay. And then another just brief cultural question for a participant who follows a halal diet. Were consideration of cultural needs for these kinds of religious requirements taken into consideration? So how would someone on a halal diet be able to participate in the program, given the options that you've recommended?
We also have a table in the report addressing both halal and kosher and vegetarian. So there's, I believe, all in one table, all of these variations in dietary preferences and cultural preferences. My understanding, and Kathy, jump in anytime, is a lot of this has to do with what states choose to authorize. So a lot of what's recommended in these recommendations certainly can be follow halal and kosher food practices. So it becomes state-to-state decisions related to foods that are authorized to meet those specifications.
We have to remember that the main thing that distinguishes the halal and kosher foods is the presence of pork. And the WIC program does not offer any pork. It also matters how the meat is handled. So the only place there's any meat is in the infant meat, the jarred infant meats, and I can't tell you whether that is kosher or not kosher. But let us just say that for the most part, the package should be okay, and if there's any doubt, the table that Shannon just referred to you would be the Bible for this.
Okay, thank you. Another breastfeeding question. Is there any evidence-based research that while partially breastfeeding women have increased, maybe the long-term effect will end up increasing the exclusive breastfeeding just more gradually? Has it been long enough to know?
Actually, the partially breastfeeding women decreased overall.
No, I think the question is if we can get increases in partial, might that then lead to increases in exclusive, so that if you can get through the first month with a partial package, you're successful enough so that by the second and third month, you're able to go back to exclusive. Anne, does that capture the question?
I think so. I think you've addressed it.
I love that question. I'm not currently familiar with published evidence, but I think it's an important question for us all to be looking at, and for any of us sitting in state WIC programs with access to data on this, I think it's a very important question to look at your administrative data and see what are the patterns of shifting between packages that are happening currently. Granted, we have the current packages in play right now, but how much are we seeing shifting from a partial breastfeeding package to an exclusive breastfeeding package in these early months? Really important question, but I'd love to shout out to all to be thinking about how you might answer it with existing data.
Well, also, and it's an interesting question with the current package, but it's a specifically interesting question to gather this data now so you can compare it to what happens after the USDA implements these recommendations to whatever greater or lesser extent they choose to do that. Because in either case, we have an important pre-post comparison from which we could learn a great deal.
Before the next question, I want to introduce a comment from a listener who says that infant meats are not available as kosher currently. So I think that helps answer that question.
I wonder, though, Anne, if that's a state-level decision.
It may be. It may
or
be.
If that's just a marketplace issue. Maybe it's not currently available in the marketplace. That's a great point. So things to look into.
We thank the participant who gave us that information.
Yes. Yeah.
Okay. And then, so the next question, with the amounts of milk and dairy being reduced, did the committee examine the impact on the intake of nutrients that milk can provide, such as calcium, potassium, and vitamin D, with the revised food packages?
Okay, here we want to make a clear distinction. We now know from the data that the committee had available to us for the first time, we had actual evidence that what is offered by WIC is not what's redeemed, and what redeemed is more than what's consumed. So you can look to see a genuine fall off as you move through that continuum from what's offered to what's redeemed in the store to what's consumed by the participant. So what the committee modeled was what people would redeem, and we assumed in this analysis, particularly for dairy, there are non-consumers, and those non-consumers are probably still going to be non-consumers if you change the amounts in the package. And there are people then who consume a whole wide variety above nothing all the way to the total amount. We actually expect that the total quarts of milk redeemed will not, the quarts of fluid milk equivalents, and that includes the cheese and the yogurt, expressed as fluid milk equivalents, will not differ between the current situation and the proposed situation. And that's a combination of less fluid milk, but more choices to preferred foods, particularly more yogurt, and particularly to the yogurts that people, the smaller yogurts that people like to use. Now, whether the states will choose to offer enough of those to make a difference, we can't tell you, but we are not predicting that the total amount of dairy consumed by the total WIC population is going to go down, but the amount offered is going to go down. I hope that was clear. Shannon, do you want to add anything to that?
Great job. No, thank you.
Okay, thank you. Next question, did the committee at all discuss the elimination of popular cereal options and decrease in choices because of the increased whole grain requirement, potential problem for program retention?
The fast answer to that is yes, we did talk about it. We didn't consider that changing to a whole grain option was going to cause people to not participate in WIC, that we felt that WIC has a lot to offer. And we hope that people would at least try the cereals, and they might like them. Shannon?
Yes, I mean, I think the answer is true. We absolutely discussed that concern. Again, the shifts in the marketplace are significant. So the current very popular cereal would be one of the very popular cereals now has a whole grain option. So again, that was part of our deliberation, and sure, there's concern that when you put up a policy recommendation that might mean removal of some favorite cereals, what will participants choose instead? And there really are some better options that are quite similar to those favorite cereals that are now formulated in a whole grain option.
Okay, thank you. Next question, I hope I haven't read this one already, but I think not, so correct me if I'm wrong. The current nutrition research shows fat from dairy, for example, whole and 2%, does not contribute to overweight and obesity in children and adults. Given current concerns about retention in the program, did you discuss at all anything about allowing participants more choice for milk?
Some version of that we have discussed already, Anne.
Okay. All right. And then, so another question is, what happens next for your recommendations?
So these recommendations were received by USDA in January, and they will do what they do with them. For the first thing they have to do is see if we answered all the questions they asked us. There has been some subsequent dialogue about that. And then they have to decide if they wish to implement these. If they do, they have to allow some comment. We are not yet at comment. If they wish to make changes, there is further work to do to consider the regulatory impact of any changes that they might make to the package we have proposed. Shannon, do you know any more about this than I do?
I do not, but thank you.
It's definitely in USDA's hands, and they have already been working on it for 7 months, and we know they're working on it. I don't know, Anne, if you wish to speak to that at all?
I think it just has to go through the regulatory process, so the agency has to consider the recommendations and then formulate the public question and comment period, and then go through the regulatory process. And generally, if I'm not mistaken, it takes about 4 or 5 years for that process to take place, from beginning to the time that you actually have a recommendation or a regulation.
It was less than that before, Anne. I mean, the 2006 report was implemented in 2009, and the 2006 report did not include a regulatory impact analysis. So I will admit I'm hopeful that we're looking at a timeline less than 3 years, because this committee has provided already to USDA the regulatory impact analysis that accompanies these recommendations, and that was not part of the requirement to the 2006 committee.
Mm-hmm. Okay. It all depends on how many changes, if any, USDA wants to make to what we recommend. But the committee does not write the regulations. USDA needs to take the recommendations, write the regulations, and then have public comment on those regulations. And as we said, there also needs to be a regulatory impact analysis if there are further changes. So I wish we could tell you what's going to happen yesterday, but it's definitely not. And we're not part of it. Dr. Whaley and I and Dr. Yaktine are not part of this process, so we're not actually the best people to ask. But thank you for trying.
Yes, thank you. All right. The 2006 recommendations included urging USDA to find a way to add vitamin D supplementation for breastfed infants. Is there a reason why that recommendation is not included in this report?
Was not part of our task, I believe.
Right. I don't recall ever seeing that in our task.
Yeah, I think that's right.
So just so the listeners know, expert committees at the National Academies work to a task, and we are required both to meet that task, that is to complete it, and also not to go off task and do things that are not part of the task. So if it was not part of the task, a supplement of vitamin D would not be an allowable thing for us to do, to discuss and make recommendations on.
Good. I think we have covered most of the questions. I'm seeing a few that are repetitious, so I think we've covered the bulk of the questions. We can give it just a couple more seconds. Oh, here's one that just came in. Will the weight height grid be used? Excuse me, I just lost it. Will the weight height grid be used in WIC? Used in WIC be addressed?
That falls outside the task of this committee, but it's an excellent question to USDA.
Okay. Will cream of wheat and malto meal be eliminated due to not being high in whole grain?
I'm not an expert. We'd have to go back to whether those are, whether they have formulations that are whole grain.
Okay, good. And then I think probably what will be the last question, could the current mom-baby dyad categories are fully breastfed, mostly breastfed, some breastfed and postpartum, in parentheses, no breastfeeding, is the recommendation to combine mostly and some breastfed into one partially breastfed category? So I think they're asking for clarification on the dyad categories.
Right. So the recommendations of this committee are exactly aligned with the recommendations in the 2006 report with those three categories. So the further subparting or separating of the partial categories was done somewhat. I'm not sure exactly how that was conducted. So the committee is recommending these three packages and really thinking about the alignment between what the infant's getting and what the mom is getting, such that there's consistency that as more formula is going into the household, that there's probably lower nutrient needs for mom in those situations. But as more breastfeeding is going on, there's higher nutrient needs for moms. That's really the backbone of these three packages as they're currently recommended.
Shannon,
I shouldn't say three packages, three dyads.
The questioner asked about 4 different levels of breastfeeding, none, a little more.
Partial, mostly, partially, some, right.
Yeah, and the committee did not describe partially, mostly, and partially some. It's just called partial.
Correct.
And the cut is at 50% of the child's need for formula.
Okay.
Correct.
Okay. And then lastly, this is, I believe, asking for clarification on regulatory impact analysis. So we may want to refer the questioner to the report. But at any rate, could you discuss the burden on state agencies and vendors as criteria in making your recommendations? How is it defined? What did you learn about burden in implementing recommendations?
Well, that's a big question. We learned quite a bit about it from our observations and from the public testimony that we took. There is some limited literature on the subject. This is difficult to quantify, but our regulatory impact analysis provides detail on the criteria used in that part of the report. We did try to choose ways of implementing the package that reduced the burden on the state agencies, the food manufacturers, and the local vendors. And indeed, our chapter on the regulatory impact analysis is the place to go. And let me end by reminding you that you can download the report for free and other materials at the Academy's website on your screen. All you have to do is tell them you have a need for it, and it pops up on your computer screen for free. The report is quite extensive, so be prepared for lots of pages of tables, but the answers to your questions are definitely in the report. And thank you so much for being with us today.
Thank you. Thank you both. It looks like those are all the questions we have time for today. Don't forget, you can download the free copy, as Dr. Rasmussen said, at www.nap.edu. Again, we will be, a copy of today's recording and the slides will be posted to our website within the next week or so. If you have additional questions, you can email us at our general email address, which is fnb@nas.edu. And with that, I would like to thank our speakers, Dr. Kathleen Rasmussen and Dr. Shannon Whaley, and thank you all again for participating. Have a great day.